the station that's on your side. This is Channel 7 News Daybreak.
Welcome back. When it comes to serving patients, home health and hospice can be one of the busiest when it comes to numbers of patients. However, there's still a lot of misunderstanding around what exactly home health and hospice do and the difference between the two. Joining us this morning is Baptist Health's Dr. David Gerson with Sherwood Family Medical Center to explain Baptist Health's programs in these areas. We were just visiting. Yeah, this is important information that people need to be more educated about. We think we know what hospice is. We think we know what home health is, but things have changed over the years.
Yeah, they have. The first thing I'll talk about is home health. That's probably the easiest thing. The home health is just a way to bridge someone's health care from the hospital to the home. Someone who can't get to clinics, can't get to their family doctor, can't get to physical therapy because they're too ill. We can do that at the home. And so that's really an important thing to know about, that we serve, actually, Baptist and the other area hospitals serve probably 4 or 5 times more patients in the outpatient home health population than they do in the hospital. And that's also why it's so important that a lot of folks don't understand that are in the health or want to become health providers. We need nurses. And so that's also a career for some to think about. Hospice is one I want to spend a little bit more time on, because that really is a critical service that is, I think, really misunderstood.
Sure.
I think when families hear the idea of hospice, they think you're asking us to give up on the patient, and that is far from the case. Hospice just simply means that a patient has an incurable disease that we probably don't expect them to live more than 6 months, and so we want to get them in a program where we're offering services not just to the patient but to the family as well, to kind of prepare for that, and also just treat the patient with dignity and make sure they're comfortable through that process. I said before that hospice loves nothing better than to discharge a patient from hospice after 6 months.
Right.
But the sad thing is that the average hospice stay countrywide, nationwide, is about 2 weeks, and it really doesn't give us enough time to really help the family and the patient kind of make that transition.
How is hospice funded? Do we know? I mean, how do families talk about that particular part of it?
So there's some insurances do cover some of the services. We have a phenomenal volunteer staff, and without them, hospice couldn't exist. And these are people who themselves have gone through hospice and see the service that it provides and the value of it. And then also there are fundraisers. I mean, we do a lot of charity. They do a lot of charity work throughout the year for all the hospice organizations in Arkansas.
The important thing is to really sit down and talk about this issue.
To have that conversation, it's really important, because it really can be so helpful for the patient and the family.
All right, great information this morning. If you are in a situation or have a family member in a situation like that, if you have questions, you can always call the Baptist Health Helpline at 1-888-BAPTIST.